Please listen to the important safety information, including the boxed warning at the end of this video, and read the accompanying full prescribing information. The proposed mechanism of action for Nuplazid, designed to target key serotonin receptors. Nuplazid, pimavanserin, is the first and only FDA-approved treatment for hallucinations and delusions associated with Parkinson's disease, or PD psychosis. Parkinson's disease is typically associated with motor symptoms. However, a common non-motor symptom of PD is often overlooked: psychosis. PD psychosis is a debilitating disorder with hallucinations and delusions that tend to emerge later in the disease course. While the exact cause of PD psychosis is unknown, it has been theorized that natural disease progression alters key pathways in the brain. Natural degradation of cholinergic and dopaminergic pathways has long been suspected as a cause of PD psychosis. The imbalance of dopamine and serotonin is another hypothesis thought to contribute to symptoms of PD psychosis. More recently, animal models of PD psychosis have shown that altered serotonin-mediated signaling through the 5-HT2A receptors may also play a significant role in the development of PD psychosis. Certain classes of compounds are believed to cause hallucinations, primarily through activation of 5-HT2A receptors. An example is lysergic acid diethylamide, or LSD. LSD is a 5-HT2A agonist, which produces hallucinations in healthy individuals. 5-HT2A receptors are found throughout the brain, with the highest density located within the cerebral cortex. Abnormalities in 5-HT2A neurotransmission may be involved in the neural mechanism of PD psychosis. An in vivo imaging study in PD patients with visual hallucinations has shown increased 5-HT2A receptor binding in the cortical regions. These alterations were found in the ventral visual pathway as well as frontocortical areas, which are involved in perception and recognition and may be a contributing factor to symptoms of PD psychosis. Thus, 5-HT2A receptors likely play an important role in PD psychosis. In vitro studies demonstrated that Nuplazid is a selective serotonin inverse agonist with no appreciable binding affinity for dopamine, histamine, muscarinic, or adrenergic receptors. The proposed mechanism of action of Nuplazid could be mediated through a combination of inverse agonist and antagonist activity at serotonin 5-HT2A receptors, and to a lesser extent at serotonin 5-HT2C receptors. At the therapeutic dose of 34 milligrams, Nuplazid does not bind to dopamine, including D2, histamine, adrenergic, or muscarinic receptors. Nuplazid is an inverse agonist that selectively inhibits the basal or constitutive activity of 5-HT2A receptors. What is an inverse agonist? An inverse agonist suppresses basal or constitutive activity of a receptor, while an antagonist blocks ligand stimulation of receptors, but permits basal or constitutive activity. And Nuplazid acts as both an inverse agonist and antagonist because it inhibits the stimulation of 5-HT2A receptors and, to a lesser degree, 5-HT2C receptors, and suppresses their basal or constitutive activity. Essentially, Nuplazid decreases activity of 5-HT2A receptors even below baseline levels. Nuplazid was proven in a clinical trial to reduce the frequency and severity of hallucinations and delusions in patients with PD psychosis. Effects on motor function with Nuplazid were comparable to placebo. Please listen to the following important safety information, including the boxed warning, and read the accompanying full prescribing information. Nuplazid is an atypical antipsychotic indicated for the treatment of hallucinations and delusions associated with Parkinson's disease psychosis. Warning: increased mortality in elderly patients with dementia-related psychosis. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. Nuplazid is not approved for the treatment of patients with dementia-related psychosis unrelated to the hallucinations and delusions associated with Parkinson's disease psychosis. QT interval prolongation. Nuplazid prolongs the QT interval. The use of Nuplazid should be avoided in patients with known QT prolongation or in combination with other drugs known to prolong QT interval, including Class 1A antiarrhythmics or Class 3 antiarrhythmics, certain antipsychotic medications, and certain antibiotics. Nuplazid should also be avoided in patients with a history of cardiac arrhythmias, as well as other circumstances that may increase the risk of the occurrence of torsade de pointe and/or sudden death, including symptomatic bradycardia, hypokalemia, or hypomagnesemia, and presence of congenital prolongation of the QT interval. Adverse reactions. The most common adverse reactions, greater than or equal to 2% for Nuplazid and greater than placebo, were peripheral edema, 7% versus 2%, nausea, 7% versus 4%, confusional state, 6% versus 3%, hallucination, 5% versus 3%, constipation, 4% versus 3%, and gait disturbance, 2% versus less than 1%. Drug interactions. Strong CYP3A4 inhibitors, for example, ketoconazole, increase Nuplazid concentrations, reduce the Nuplazid dose by 1/2. Strong CYP3A4 inducers may reduce Nuplazid exposure. Monitor for reduced efficacy. Increase in Nuplazid dosage may be needed. Renal impairment. No dosage adjustment for Nuplazid is needed in patients with mild to moderate renal impairment. Use of Nuplazid is not recommended in patients with severe renal impairment. Hepatic impairment. Use of Nuplazid is not recommended in patients with hepatic impairment. Nuplazid has not been evaluated in this patient population. Pregnancy. Use of Nuplazid in pregnant women has not been evaluated and should therefore be used in pregnancy only if the potential benefit justifies the potential risk to the mother and fetus. Pediatric use. Safety and efficacy have not been established in pediatric patients. Dosage and administration. Recommended dose, 34 mg per day, taken orally as 2 17 mg tablets once daily without titration. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also call Acadia Pharmaceuticals Incorporated at 1-844-4-ACADIA. That's 1-844-422-2342.